Living a New Life. I'm Dr. Elliot Hirshhorn, and I spent the past weekend learning more the latest research on thyroid disease and Hashimoto's. In fact, myself and two other members of our team spent the entire weekend doing continuing education. It's something that we take, something that we value very, very seriously in our office, to get the latest information available so that we can help our patients the best. And so myself and our nutrition Hashimoto's disease, and learn more about different ways to treat people with physical joint pain, neuropathy, etc. So what I want to talk to you about today is a little bit more about one of the specific topics that we discussed over the weekend with Dr. Karazian. And one of the jumped out as the controversial topic in thyroid disease, Hashimoto's, and that is iodine. But if you look at the research, the controversy becomes much more really isn't that controversial anymore. So I want to go over with you some of the things that we discussed this weekend about Hashimoto's and iodine. One of the things that you will notice is if you do some research, people on both sides, and there are some very well-intended, well-meaning people out there that are recommending iodine supplementation for Hashimoto's, but the research, it doesn't support this continued use. So when we're dealing with iodine, some of the research that we looked at has actually called it a public health threat because of the impact that using iodine can have on the overall progression and severity of disease and Hashimoto's. Because it's creating such an issue, some of the research is actually using that terminology. So what are we seeing? If you look at the research, excess iodine, and this can be from supplementation, but it can also be from food. They did some of the studies on measuring amounts of iodine that people are eating in their food, and we're seeing that that is even having an impact. So excess iodine, it causes an increase destroy those thyroid follicle cells, those thyrocytes. You're not going to be able to produce the thyroid enough quantity, so you're going to decrease your thyroid production. One of the other things that it does is iodine really becomes like gasoline on the fire when we're talking about disease of Hashimoto's. And what that does is it causes the thyroid to become more and more attacked or destroyed. And if you destroy more of the thyroid, it's going to function even less. And so if you destroy it, you decrease the production, you increase the attack by the immune system on this thyroid, then ultimately you're going to have more and more symptoms. But long term, this is not going to be a good solution because the research shows that it does create all of these issues. So what they did was there's multiple studies. It's been looked at all over the world: China, Slovenia, the United States. Country off the kind of the other side of the Adriatic Sea from Italy is Slovenia. It's a beautiful country. I actually spent a day there. Kind of a was they took their table salt and they increased the amount of in the table salt and doubled the quantity in their table salt. And what they found was that there was a doubling in the incidence of Hashimoto's in the country. So increase the amount of iodine in the salt, everybody's getting more iodine, and then there's an immediate 2-time increase in the cases of Hashimoto's after that. So it's a pretty good cause and effect relationship there. So what about looking? So if we see that iodine is doing these things and we see what happens when we add iodine, then the question becomes, well, what if we take iodine away? Are we getting an improvement in thyroid function? Well, in fact, that is the case. So if you do an iodine restricted diet, iodine restriction, not only from the food, but making sure that none of your supplements are getting iodine as well, it showed that 78% of people who did an iodine restriction actually had a return to normal of their thyroid function, and that's all they did. So not only improvement in symptoms, but TSH normalized as well, which is really profound when you think about it. So 78%, or almost 8 out of 10 people who did this, noticed that when you restricted that iodine, they had returned to normal function. So all I can say for you, and what we're seeing in full research studies, is that although iodine is a hot topic and it's all this iodine in our systems from our diet. So you don't need to take additional iodine. Your thyroid actually will store iodine. It's kind of a hotbed for that iodine, so it'll store it for future use. You only really need about a pinhead's worth of iodine a day, which is about a tablespoon or two. Because of its effect on the thyroid function. Not only are you not able to produce enough thyroid, but it actually destroys thyroid tissue, creating a long-term increase in iodine. Not a great idea for Hashimoto's. Hope this. We'll talk to you next time on Living a New Life.